Good morning, everyone. I just want to take a minute and welcome you. I'm Tricia Mlott. I'm the county's Behavioral Health Coordinating Council Supervisor. This morning, we are doing a panel of several of our crisis providers within the county. I am asking that you kindly give us a couple of minutes. We have one panelist who is working on getting their camera to be visible so that you can see their lovely face as well. So we didn't want to keep you waiting and hanging and wondering if you were in the right place at the right time or not. So bear with us and we will start in a couple of minutes. Okay, we will go ahead and get started. We do have one panelist who will be with us by phone today for the entire time, and then we have another panelist who may be able to join us by video, but at the very least will join us with audio and contribute to our conversation. Again, I appreciate that all of you are taking the time to join us this morning. We know that 8 o'clock can be early for some people, and at the same time, there are others who have been at work for a while. Regardless, we appreciate that you are giving up part of your Wednesday morning to learn more about the crisis services within the county and what some resources are available. As I said a few moments ago, I'm Tricia Malott. I'm the county's Behavioral Health Coordinating Council Supervisor, and this is one of our forum sessions in the 2020-2021 McLean County Community Behavioral Health Forum. If you have attended in person with us in the past, then you likely know that this is our 4th year of doing this, and that this is definitely different than the way we have always held the forum historically. And while we miss some of the energy and the connections that happen at an in-person event, we have also found a lot of positives by holding this in a virtual format. We've had a lot of really positive feedback that people can attend multiple sessions and not have to choose between 2 or 3 that they really want to go to because they're all offered at the same time, as well as in this case, you are dedicating an hour, or in this morning's context, 2 hours potentially to hear a session rather than the idea of 1 full day. So in light of a challenging year and planning an event, we are trying to take those challenges and also find what the positives are in them. The forum originated out of the Mental Health Action Plan, which was adopted by the county board back in 2015 and brought with it several initiatives, but one of them was the idea of an annual event that would help reduce the stigma surrounding behavioral health, increase awareness and education in the community, as well as help bring resources to people so that they know what options are available. With us this morning, we have, and I'm going to apologize in advance if I pronounce his last name incorrectly. We have Anthony Replinger, who is with OSF. We have Kevin Richardson from PATH, Nicole Kirstein from the McLean County Triage Center, Megan Moser from McLean County Center for Human Services, and we also have Nick Jones, who is from Bloomington PD. And then Kevin McCall is also with the county, and he will be our question moderator this morning. A few things, if you have questions throughout the presentation, please put them in the questions box. That will allow us to keep track of them. We try to not duplicate questions. We will ask them of the panelists at the end. The way that we'll structure some of our format today is the first part will be a panel of our crisis providers discussing what their particular resource encompasses. They'll talk a little bit about what they do versus what they don't do, how they intersect with other crisis providers, and how they all fit into the bigger picture of the crisis puzzle within the county. Our second half is going to be a little bit more about what resources are available and how to access those. And so today is largely it's a conversation. If you've attended in the past, it should be relatively similar, but perhaps with some new additions. When you ask your question, make sure that there's context, because when we ask that at the end, we may not know what you were referring to if you ask something like, tell me more about that. So if in that context you want to know, tell me more about how it works when mobile crisis gets called. And that's your question in that particular moment, make sure you give us the context for that. And with that, I am actually going to hand it over to our panelists to start, and know that they've done this enough times that I can kind of take a step back, and they'll give you a little bit more information about themselves as well as their organization and their crisis services. So Megan, I don't know if maybe you want to start, because I know when I've attended in the past, it seems like you have sort of kicked the discussion off. So.
Sure, I can do that. So I'm Megan Moser. I'm the program manager for our crisis team in the county. And normally I kind of start off because we kind of have our hand in with everybody that's kind of on the panel. So, so for us with mobile crisis, we're one of the counties in Illinois that has it, which is really nice. So some of the services we provide is doing some psychiatric assessments and meeting with people who are in a mental health crisis. So part of how we get called is the person needs to be in McLean County is the main thing. And the only group of people that we don't provide services for would be 20 and younger with Medicaid, because that would be the SAS contract, and that's run through Center for Youth and Family Solutions here in town. We don't expect people sometimes that call us to know if it's us or if it would be SAS, but we try pretty quickly to let you know and get you to the right place if you did call us first, just so that you don't have to tell us everything and then have to call a whole nother place again. But everybody else we would see. So we see children and adolescents all the way up through adults. We provide services on a mobile basis, so it can be anywhere within the county. So sometimes that can be at somebody's home, sometimes that can be at a doctor's office, it could be in the schools, and then we do provide services in both of our hospitals, so at OSF and Carl Broman as well. So kind of lots of different places that we can meet with people. We meet with people both over the phone and in person. So sometimes, depending on what somebody's calling for, they may just feel more comfortable talking to us over the phone, which is totally fine. Or sometimes we'll discuss, our availability to be able to come out and meet with somebody in person. So usually the things that we would go out on the most would be, somebody struggling with an increase in symptoms. So maybe some psychosis symptoms, could be some increase in depression or anxiety. It could be having suicidal thoughts or homicidal thoughts. So we go out on all those different kinds of assessments. We can actually go out in the community. So that's where we work with both Normal and Bloomington police departments to maybe go out and meet with somebody there, or again, kind of meeting with each different entity. In this panel, we can provide services pretty much almost anywhere. How you get a hold of us is normally how I hand off to other places. Is you can contact us through our office during business hours during the day, which that phone number is 309-827-5351. Then that gets answered by our office, and you just ask to speak with crisis, and then they page us. Or after hours or on the weekends, that's when our phones go to PATH, who actually answers for lots of different places, like Kevin will tell you. But they answer for us, and they help get us the calls so that we know where we need to go. So that's kind of a little bit about what we do. Maybe I hand it off to Kevin, who maybe can talk about PATH, since you answer for so many of us.
Yeah, thanks, Megan. And so my name is Kevin Richardson. I'm the call center program manager at PATH Crisis Center. And our primary role, as far as McLean County's behavioral health is concerned, is that we offer a 24/7 crisis hotline. And so, like Megan said, we're answering for a lot of different entities. We actually don't just serve McLean County. We're answering for 47 counties for 211 services across the state. And I'm going to talk a lot more about 211 in general in the second half of this presentation, because that's when we really get into resources, referrals, what can we provide people in addition to crisis services, because a lot of times crises, they're accompanied by a need in specific services and whatnot. And so 211 is sometimes essential for that. And so generally speaking, we've been in the community for a long time. This is actually our 50th year. We started in 1971, so happy 50 years to PATH. But we do that crisis hotline, and so like I said, we're available 24/7. About 25% of our total call volume is actually from McLean County. So yes, we are answering for other areas across the state, but we've been established here for so long as a crisis hotline that sometimes people just know, call PATH. If you're dealing with almost any sort of crisis, whether it's mental health related or not, just call PATH. And we have volunteers and staff who are highly trained to primarily listen to folks. Whatever it is you might be going through, we want to make sure that we're validating that, and we want to make sure that you feel heard and that your problem feels heard. And then, try to break down what the issue is and go from there, essentially. And so that might be providing you resources. That might just be that you needed someone to talk to for half an hour. That might be that we connect you to the crisis team or the triage center, or you end up needing to go to the hospital. Whatever it is, we're not going to let you just go. We're going to be there every step of the way if you call us. And so we answer for the National Suicide Prevention Lifeline as well. So in McLean County, if you dial 800-273-TALK, you'll reach us, but you can also reach us by dialing 211. You can reach us by dialing our regular crisis line. That's 309-827-4005. 211 is the easily marketable one. It's easy to remember. So that's what we would primarily say, but I think there are a couple cell phone companies that have issue with that. But we are there as sort of a screening sometimes for the crisis team as well. So like Megan said, we answer for them after hours. And a lot of times people will just need to talk, or it's, you know, they've been within the mental health system for a while, and it's literally part of their safety plan and part of what to do to call PATH. And they just know that we're there 24/7 and we're there to listen and provide resources as necessary. But we are trained to handle suicide situations as well. So if you're thinking about suicide, or you know someone who's thinking about suicide, what's part of our 48-hour training for all of our volunteers, and then we provide continued education for all the volunteers throughout the year, is that they're able to assess, and they actually operate pretty similarly to the crisis team. Crisis team will be able to go out to people's homes if they deem that necessary, or be able to visit people at the hospital. We can't do that. Everything we do is over the phone. But as far as the safety planning, and ensuring that, you know, you have sort of a short-term plan and a long-term plan, and that you feel, again, validated, and that you're safe in the moment. We're doing all of these things over the phone. The last thing that we want to do is send the police to your home, you know, if we can avoid that. And most cases, we'll get to talking a lot more, but most cases, people just need someone to talk to, especially right now when not only, you know, there's a lot going on, but literally the nation is in a crisis. And so a crisis hotline is precisely the thing that some people need, or people who have been social distancing and whatnot, and haven't been in contact with people. We're seeing a lot more lonely folks out there. And we're actually seeing our mental health related calls go up as a result, especially over the past few months. So we're there in a lot of capacities, and we're always operating in the least invasive strategies possible. So whatever that might mean for you, we're just here to talk and figure things out and let you know that you're not alone. So happy to keep talking about PATH, but I'm going to pass it on to the next folk. I don't know who that's going to be.
Let's have Nicole, if you could talk about the triage center. And so we'll sort of work our way up, and then we'll have Officer Jones, and then Anthony with OSF go after you.
Hi, that's actually perfect, because we do a lot of the same things that PATH and Mobile Crisis are doing in the community. Triage started back last March, and if you remember, that's when COVID kind of started and we were sheltering in place, but that's when we opened, and we fill in the needs where there's some gaps in the community for services. So we don't have a public phone number because we don't want people calling us to get that telephone crisis intervention that PATH does. We don't go out to people's homes to do assessments. People come to us. So we're not doing what Megan and her team are doing. But we all are doing the same assessment. And I think that kind of shows how we kind of work together and collaborate and make it easier for not just each other, but for the client, so they don't have to repeat things over and over. So people will come to us from different ways. One of our biggest referrals is the crisis team and law enforcement. So if law enforcement, and Nick will get into this as well later on, if they come across somebody that they think would be better helped with the triage center, they can actually drop people off that have a low level offense, such as maybe trespassing, come to triage, and they can get in and out of our office within about 5 minutes, so they're able to get back on the street and go to the next call, so they don't have to take somebody to the hospital. We can do the assessment here, and then if it is decided that they do need a higher level of care, then we can get them over to the hospitals. And I think that's really important, so that we have limited resources and we're just all trying to work together to make it more efficient for the client and for the community as well. And then if somebody comes into us, then a lot of times they're hearing about us through friends. They can come in from 7:30 a.m. to 3 a.m. and get an assessment done. If somebody needs to stay longer than 3 a.m., we are able to stay longer. People can stay with us up to 23 hours. We don't have any beds or anything like that. It's just so they can be in a safe place. For example, we've had people that aren't actively suicidal, but they just feel safe being with somebody else. So just staying here really helps them, and they're free to go whenever they want to, as long as they get the assessment done and they're not a risk to themselves or others. And we really try and link people to resources, and not just give them a sheet of paper and say, here's where you need to call. We really want to make that connection so that people aren't having to make lots of phone calls, because that's the last thing you want to do when you're in crisis is make a bunch of phone calls. So we try and make that as easy as possible for them. And we give them information like before they leave of, if you do need to talk to somebody, you can call Pat and make sure they have that phone number. If they do need somebody to come out to their home, or if they need to go to the hospital, we can make sure that they have that information. And of course, like Megan and her team, we create a safety plan. And actually that's how some of our referrals came to us, is Megan and her team maybe made a safety plan with somebody in the hospital, and one of their things on their safety plan was to come to triage to check in the following day, and that was, I think, really helpful. Other than that, we are open, like I said, open 7:30 a.m. to 3 a.m. 365 days a year, and we don't have a public phone number, but providers can call and give us a heads up, if we will be getting somebody to come in. Maybe law enforcement will give us a heads up that they're dropping somebody off.
Okay, thank you. Anthony, if you could talk a little bit about what it's like when somebody comes. I mean, you can only speak really to what it's like when they come to OSF, but talk a little bit about the emergency room process and the role that you play with regard to individuals in a behavioral health crisis. Anthony, we can't currently hear you. It looks like you're unmuted, but we're not able to hear anything.
Can you hear me now?
Yes.
Okay. So I am Anthony. I'm the emergency department manager here at St. Joseph's Medical Center. I am an RN, and kind of what our role in all of this is that Our greatest drive is to provide safety. So when people are coming in an acute crisis, we're providing that safe place till they can be evaluated or be placed. Work with other entities such as SAS or Crisis to help with placement as well as transport of these patients as needed. And then we also provide kind of a means to get that required medical clearance in certain situations. Providers work very closely with members from the crisis team and the SAS team to really look at, what is best for the patient in that particular situation. Whether that is a safety plan or placement or those types of situations. But at the end of the day, our greatest role in this entire process is to keep people safe in times of acute crisis.
Okay, thank you. We are, Officer Jones had to log off of the computer that he was using and is attempting to get back on. So he is one of our other panelists. And we want to make sure that we have time to hear from law enforcement because they do play an important
I am
piece.
back.
Oh, wonderful.
I'm on the phone now, so I hope that works for everybody.
Yep.
And it's weird because I'm actually seated in my office, which is a squad car, so I think that probably works better for me. So my name is Nick Jones. I'm a Bloomington police officer. I've been here 16 years, and in my career, the mental health aspect of law enforcement has changed dramatically. We work with everybody involved here. We work with crisis team, PATH, CHS, both hospitals here in town. Our role starts probably from I don't want to say the onset of somebody's mental health history, but we deal with people when their family, I think, first notices something and they call us because they don't know how to get that treatment or how to reach out to somebody else, like how to reach out necessarily to CHS or PATH or the crisis team for that help. A lot of people just call us because they think it's a law enforcement matter. And a lot of times it's not. It's not a criminal matter, but they do reach out to us. And then we show up. And everybody here at the police department is CIT trained, crisis intervention team trained. Everybody's gone to that class. And I think that class has helped us out exponentially. I know it has me learn how to deal with people with mental health issues. So we are able to assess that, hey, we don't have a criminal matter here. This person needs this, and this. So we'll either call the crisis team out to deal with that person right there if the person is not trying to harm themselves or somebody else. Or if they are trying to harm themselves or somebody else, we'll deal with that accordingly. We'll call for rescue, get them transferred to the hospital for further care. And then we'll go from there and hopefully that person gets stabilized and gets back to be a productive member of society.
Okay. Can you each take a moment and maybe talk about what you have seen with regard to behavioral health needs in the past several months, even going back through what the past year has been like, and how it has impacted the services you're providing, but also what you're seeing as both needs and what helps people at this time?
I can start if that's okay with everyone. So we have a pretty unique perspective with that because, like I said, we serve multiple counties, so I can kind of see how it's affecting different parts of the state and whatnot. In McLean County specifically, it was one of the more interesting cases. So early on in the pandemic, March, April, and whatnot, when our call volume in general through 211 was shooting through the roof because people had lost their jobs, needed resources, didn't know what to do, sort of thing. Yeah, we were certainly getting those sorts of calls from people in McLean County, but our overall call volume from McLean County went down for a few months. And it was interesting. I think Megan's probably going to say the same thing happened on her end, because a lot of our calls are support only calls. And what that means is people are just calling in. They don't need any specific sort of resource. They just needed to talk to someone. And I hesitate to use the word exciting because it was a terrible kind of exciting. But I think it was new. Everything that was happening was new. People, it was exciting in this weird sense of the word, where no one had ever experienced anything like this. Like, we have to stay at home, sort of thing. And it's just after 3, 4, 5, 6, 7 months of that, it's no longer exciting. It's like, uh-oh, this is the new norm, and I hate this. And so what we saw in McLean County is initially that call volume went down, but now we're seeing more mental health related calls. People who have been stuck at home are not enjoying that. Not to say that everyone was enjoying that, but certainly I think it's getting old now. It's no longer exciting, it's getting old. And very understandably so. I think this is affecting everyone in some capacity, obviously. And I think the people who are already most vulnerable, that's who it's affecting most. And so that's typically people who have low incomes, people who already had mental health issues, people who already had high anxiety, things like that. And so we are seeing increases in suicide-related calls, increases in mental health-related calls, increases in support-related calls. And now we're seeing increases in, rent assistance, utility assistance. We have been for a few months. So our call volume is back up to normal and some. Specifically in McLean County, and there's lots of different analysis of the data and whatnot, but I think that sort of sums it up. It started out low, and now people are really needing that support, and we've seen that increase.
Yeah, I was gonna say very similar to what Kevin said. I think to add to it, a lot of what we tried to do at the beginning, kind of where everybody touched on, was a large part of what we all do is give resources and referrals to people and things. And at the time when everything kind of first started, it was really hard to know what was still open, who was still providing what services. We were right at the get-go on the phone with each other saying, hey, for some of us, especially for us in mobile crisis who were going to the hospital settings, we had to change how we were going in to try to, maintain our health as far as we were concerned, which meant that we might not be able to get to people as fast as we wanted to. So we called the triage center, we called different places and said, hey, if we've got an increase in calls, where can we send people so that we're getting to everybody as quickly as possible, and kind of work together as a group to do that. We were on the phone with Pat saying, hey, if you've got a lot of calls or you need to give us some calls, like, let's try to figure out how we can handle this, because we had no clue if we were just going to get a bunch of calls all at once or if we weren't. So it was really nice to kind of get on the phone with everybody and say, hey, how are you guys doing? And then how can we figure out how to do this? So we kind of were calling a bunch of places, trying to figure out resources. Kevin's right. What ended up happening for us too is at the beginning, we thought we were going to get a lot more calls, and it actually went down. I think it was new, just like Kevin said. I like how he said exciting. It was definitely, something to get adjusted to. And then what we've seen is, the effects of a difficult time, for everyone. Stress, once you have longer periods of stress, a pandemic being, a trauma for a lot of people. Now we're kind of seeing where, some people tried to, hold it together, do what they could. But, when you're talking months and months, it can be really difficult for all of us. And so we definitely have seen an increase in calls. We've seen an increase in people who maybe had some difficulty getting into the difference in services. And so maybe they weren't as consistent with maybe going in and seeing someone, or maybe taking their medications. And so we are seeing a lot more people come into the hospital setting. and maybe need to have a different level of care. So maybe needing to go to an inpatient mental health unit or the crisis residential unit, somewhere kind of a safe place. We really have had to up our safety planning, like Nicole said, for the triage center, really trying to get people in and checked on, just because a lot of times, we are seeing a lot more suicidal thoughts, a lot more attempts of suicide as well, which is really understandable given everything that's going on. And we're not quite out of it yet, so there still is that stress and still trying to figure out when can we get back to whatever the new normal is going to be. You've got anticipation, and I think too I think for anybody with kids, who are parents, and the different things that happen with the schools, it was like stress on top of stress, that kind of happened. So I think that played a role too in why we really saw an increase in calls, through the summer and then definitely into the fall of last year.
So for the law enforcement side, I believe over my career, and I'll get to recent times here pretty quick, but over my career, like 15, 16 years, when I first started, there was like very little, if any at all, mental health crisis calls for service. And then it started like increasing and getting more and more and more until recently. What I've seen over the COVID pandemic is, which I find, I don't know if I want to say odd, but usually we see in our business younger people, like when they start getting that, they fall into that mental health crisis or issue, the 16, 17, 18, and they don't know they have that yet. So we start getting those calls. But elderly people, because they can't go see their friends, they can't go out for that coffee. Their family's already out of the house, so they have nobody to talk to. And I don't think anybody's reaching out to the elderly. It's come to the point where we had a couple elderly suicides. I even dealt with the elderly suicide attempt where a gentleman actually shot himself and he lived, thank God. But it's just weird to see that aspect of it when we're usually dealing with the younger crowd when they're just starting to get their mental health issues, and then we can send them to help with, crisis CHS, stuff like that. But now we're getting that elderly range of people who never knew they had a mental health issue or a crisis or in that crisis. And now they're coming into it because something else is happening in their life that they never expected, or maybe never expected to see again, because maybe they lived through the Great Depression or something, but now they're coming into something else and they just have no resources or don't know there's resources out there. So we got to get those older people that resource, or so they know that there's people that can help them now. So it's just kind of weird to see that. I don't want to say circle, but I guess that's what it is. We deal with the young kids all the time, and now we're dealing with this older generation.
One thing that we noticed at triage, people had a hard time transitioning to telepsychiatry. They're really paranoid about doing virtual sessions with maybe their regular counselor. We saw that very early on. So we had to make some adjustments and help people through that time period. I think it's gotten better, but I think there's still that uneasiness of doing things virtually for some people. Another thing is, we opened up the week that shelter in place took place, as Trisha always says, while the world was shutting down, we were opening up, but it was, we didn't have as many people as we thought come through the door, but as Trisha said, a lot of the time throughout this time, that's probably a good thing, is people were listening and staying home instead of getting out and trying to stay safe. So I think those are two of the big things that we've seen.
I'm going to chime in on that one, and I've tried not to add my thoughts to Nicole's and let her be the presenter for triage. But the one piece I would add to what I think we've seen in trends in triage are a number of people returning multiple times. And while when we're looking at our overall data, the majority of people have only come in one time. We do have a decent number who have come 2, 3, 4 or more times. And while we're grateful that they know that we're a safe place and they can continue to come back, and it is a better resource than going to the emergency department when they don't need that. At the same time, I think it is a trend that we're seeing. We're seeing that people do need that contact. They do need that assistance wherever it be, whether it's PATH, mobile crisis, the ED, triage, or another resource. I think people are needing that contact more frequently than maybe they have in the past, because it has become more difficult to cope. So that's one piece that I would add to what I think we've seen with triage when looking at at least from the data side. Anthony, I wonder if you could talk a little bit about what you've seen with regard to the emergency departments. Okay, well, I showed him still on, and maybe he had something else come up.
I'm here. So I apparently
okay.
have to, yep, I got it. So, can you hear me now?
Yes, I can. Sorry, I had muted myself.
Okay, no problem. So what many of the panelists have said has kind of translated to an increase for us here in the emergency department. And, what does that mean necessarily? It means, yes, we might be seeing, people multiple times, people across generations, much like was mentioned by Megan and Nick. We've had an increase in adolescents, but also during this time period, placements have been more difficult surrounding COVID. People that are being placed, they need to have negative COVID tests. Testing needs to be done prior to those placements. And in situations where you do have like positive tests come back, it's made placement much more difficult. There's a small amount of facilities that take patients currently in this time period that are positive for COVID. So we have seen an increase in patients needing admission to the hospital, because we understand that the emergency department is the best place for getting better in these situations. So we have had an increase in admission to our medical floor or our ICU floor, things along those lines. So we have seen like a marked uptick in our acute crisis cases over the last approximately year now.
Thank you. So I wonder if either one of you or the collective whole of you could maybe talk about if a family member or a person does call 911 or even 211, what is their process like? I know that is one of the pieces that has been discussed in the past or off and on, but can you help walk us through what happens if someone does call for help? What will their experience be like? Who will they interact with? What does sort of start to finish look like for them?
I can start.
Yeah, go ahead.
Okay, perfect. The annoying answer is obviously that looks a little different for everyone, but generally speaking, is when someone dials 211, first of all, the person that you're getting is someone that has been 48-hour trained. We, all of our volunteers, all of our staff, at the very minimum, you're interacting with someone who has gone through an 8-week training that with PATH, it starts with communication skills, handling emergencies, and suicide, mental health, different resources that are available. So we go over the full gambit of what you might experience on the phone line, and that's always based in those basic communication, those basic listening skills. And it starts with validating what that person has gone through. So say a family member or the person in crisis themselves dials 211 because they don't know what to do right now. They're concerned for their friend, they're concerned for their brother, whatever it might be. Now, obviously it depends on the situation, but generally speaking, we're going to listen. We're gonna figure out what's going on. We're gonna figure out, are they in need of immediate assistance? Do they need to actually go to the hospital right now? Is this an in progress situation? That's what we would call it. Assuming it's not, then we're just going to assess. We're going to learn a little more about what's going on. We're going to validate the concerns, the stresses that the person is going through. And then eventually we're going to come to a sort of game plan. We use a sort of basic problem solving model, and when that involves suicide, that sometimes includes the suicide safety plan as well. But when you're calling, it's not as if it's scripted. We don't have these scripted things that we're saying. We're looking at things, you know, if someone says this, it doesn't mean you say that sort of thing. We're trying to make it a very human experience where you're talking to a person, and especially now, it's like that's what people need more than anything, is just another person who can talk to them. And so we're going to assess and we're going to figure out what the need is. I mean, if you've been struggling for 3-4 months at this point and you're afraid that you aren't going to be able to put food on the table and that's affecting your self-worth, well, yeah, we need to talk about your self-worth, but we can also talk about you know, potentially what resources are out there. Have you enrolled in SNAP benefits? Have you enrolled in unemployment because you haven't been employed for 6 months? Have you reached out to the food pantries in the area? Have you reached out, if you've been quarantining, to the mutual aid team that can provide food, even if, you know, you have COVID and can't you go out? So there's lots of different resources out there. And so it starts with listening, and then we assess, and then we come up with that game plan, essentially. And like I said earlier, we're always going to be aiming for least invasive you know, policy possible. Like a lot of people, I think, you'll hear horror stories of people called the National Suicide Prevention Lifeline and then the police showed up at their door. I train specifically not to do that if it can be avoided. It's more traumatizing. Oftentimes police, with the many things that they're doing, and we mentioned, you know, that they're CIT trained and whatnot, and that's extremely valuable and whatnot. But there's a reason that we have mental health professionals in addition to police. And so if we can avoid, you know, the trauma that's going to be, then we're absolutely going to avoid sending the police. The only time we're really going to actively send the police is if you call and you have already cut your wrists. You have the rope around your neck. You refuse to put down the gun, sort of thing. And then even sometimes it's like you don't want to use the gun, so we'll get in touch with, you know, crisis team. So it all depends on the situation, but we're always aiming for that least invasive intervention possible, and we're always with you. We're not making the decision for you. We're there to help you make your decision. And so I think that's what's key.
Right. So when you call 911, oh, go ahead. I'm sorry.
No, that's okay. I was actually going to say, do you want to go next for when you call 911, and then I can say where it goes after?
Yeah. So when you call 911, unfortunately, I believe I'm not a dispatcher, but from what I understand, the questions are scripted, and it's not personal. So that's not the best, right? When somebody's going through a crisis, so they're going to you call 911, they're going to send the police. So we go and we make contact with the individual, and at that time we're going to assess what's going on based on our call notes and what we see with that individual. And if there is a threat going on, we're going to have to handle that accordingly. But if the person is just going through some type of, hey, I need to talk to somebody, I'm not doing well, well, we're going to, of course, call crisis and either have them come out at that time, or we're going to assess the situation and see if we can't just call crisis and have them come out at their leisure if that person is not wanting to harm themselves or harm anybody else. If that person has made an attempt, we're of course going to have to call rescue out and get them transported to the hospital for a psychiatric evaluation. And unfortunately, I wish people knew more about 211 and could call so that we wouldn't get sent to a lot of mental health calls that we don't necessarily need to go to. But at the same time, that suicidal elderly gentleman that I spoke about earlier, he'd already shot himself, and he did call and said, send the police, I'm going to hurt myself. He didn't know that he had already shot himself. I think there is a place for everybody to work together. And I wish we could just figure out where it's at. When you call 911, we just go and we have to deal with what we got. And then I'm so glad and thankful we have resources in our community. I know a lot of communities don't have them, but I'm just so thankful that here at the police department we have, crisis and path, and we can call on those guys to get our clients and our customers the mental help that they need. Because we can't do it. We're not you guys. We're not the crisis workers. We're just the frontline people.
Well, I think to piggyback off of that, I think right now, just overall, people are so much more used to calling 911 for everything versus realizing, hey, maybe if it was more of a mental health issue, you could call 211 and kind of get into the same services. So I think I think people know about it more than they did several years ago, but I think it's still a process of trying to get more people to realize that you don't necessarily have to call 911 for that mental health side. But so how we kind of work in is, like Kevin said, like Nick said, so you may contact through 911, you may contact through 211. So when we would get called out is if, somebody was needing, to be seen and maybe be talked to and assessed for a mental health crisis in person. And so that's when we would basically, so who answers the phone for us are clinicians. So they are counselors who would kind of ask, hey, what's going on? And then what do you feel like would be the best place for us to meet with you? Like I said, some people, they just want to talk over the phone for, a little bit. Maybe they were talking to Path and then they wanted to talk, a little bit more. And so we'll meet with them over the phone. Sometimes we'll agree to meet with them in person. Sometimes it could be depending on where they are. So like, let's say maybe somebody's at work and they don't necessarily want us to meet with them at work. We may make a plan to meet with them later in that day when they're at home. So we just kind of talk about what would be the best option. We as well, like Kevin said, try to do least restrictive. So if possible, we'd love to save someone the time, the money, the different things of going to an emergency room if we can provide that exact same assessment at your home or something like that. So we then would come out as soon as we could. Time really just depends on how many people are needing to be seen. If an officer calls, we do the same thing. So Nick kind of alluded to this, something that we've tried to do to try to help, because depending on how long somebody would wait, it doesn't make sense to have people waiting for long periods of time. So we've given an option to officers that they can kind of let us know what they're concerned about with someone, and then we provide like a welfare check. So we'll go out and meet with that person, try to kind of connect with them, get them some resources. It may not be at that moment that the officers are there. They feel that the person can be safe enough. We would just follow up with them later. So that's kind of how that would go if an officer were to call us out. And then in the hospital setting, once somebody becomes medically cleared, so that does sometimes take a little bit of time. You heard Anthony kind of say that. Mostly it's just to make sure that somebody is sober to talk with us, because sometimes using alcohol or different things would increase somebody's risk. So we want to make sure If that's the case, and then, medically that they're okay, and then we would come out and meet with them. And again, the same assessment we would do at somebody's home as what we would do in the hospital setting. And then we would kind of decide what's the best outcome. So again, trying to do least restrictive as much as possible. We want to give resources, we want to get you referrals, we want to hook you up and educate. We do a lot of educating of, hey, we have a triage center, we have a crisis residential unit, here's some different options, you can contact PATH next time. And so when we're setting up that safety plan, we try to put that in there and actually hand them the resources so that they can use them, the next time maybe that they are feeling the same way. Sometimes the person may need to have a higher level of care, so that inpatient setting, and so we would actually contact places throughout the state of Illinois. Sometimes we try to go closest first, but yeah, with COVID, it has been more difficult just because of beds. There being less beds sometimes in the state, but we will actually contact the places, and then we will get that person to an inpatient unit for their safety. So that's kind of what it looks like with us in general.
So if somebody comes into triage, first they'll be greeted by one of our visitors aide, and they'll just make sure that everybody that comes in does not have anything that's dangerous or could hurt themselves. They'll lock up people's belongings so that they don't have to carry them with them. And then they'll meet with a peer who is somebody who has their own lived mental health or substance abuse history and are a good place themselves and know what it's like to go ask for help, maybe for the first time or when you're in crisis. So they walk them through the intake paperwork, and then they have an opportunity to meet with that peer after they're done with their assessment. So when somebody is done with their paperwork, then a specialist, a clinician, will do their assessment. Like we said before, it's what PATH is doing, what crisis or mobile crisis is doing, just trying to see what the least restrictive environment that they need is. And then once they're cleared, we give them the option they can stay with us for up to 23 hours. And at that time, they can talk with a peer, see what that person has been through, what worked for them, just to have that contact, especially during COVID, of somebody to talk to. We might provide in the moment interventions. So not doing counseling, but like helping people with grounding techniques, helping them identify those coping skills. And I would say it takes about probably, well, it's been between like 45 minutes to a couple hours that people have stayed with us. Some people have stayed much longer, up to that 23-hour mark. It, like Kevin said, it really depends on the person and what their needs are. But we don't want to, like Kevin said again, we don't want to make it cut and dry, like this is what happens when you come here. It's really up to what everybody needs, and it's going to look different for every person. But we want it to just be a really calm environment where people feel safe. We don't have any beds, like I said before, but we do have what's called a living room. Our services are based off of the living room model. So we have a warm, inviting space where people can sit, but it's not too comfortable where they're going to take naps and just go to sleep. We have some grounding objects that people can use, coloring books. We do have some snacks in case people are hungry. We know that could really affect somebody's mental health if they're hungry, and just make them feel really comfortable. So once they are done with the assessment, like I said, we will give them the option of what they want to do next, stay or go home, and then we'll follow up with them in a day or two to see how they're doing, make sure they were able to get those referrals that we gave them, get connected to those referrals, and just remind them that they can come to triage again if they need to. And then if they do need a higher level of care, we will call rescue and have them transport those individuals to the hospital.
Okay. So I know Anthony had to step away for about a 10-minute period. So I know he's unavailable in this particular moment, but Megan, I wonder if you can speak to what the process is like in the emergency department, since your team does most of the assessments, especially at OSF, but you do some at Carl Broman also. So I wonder if in his absence, you can talk a little bit about what it's like if somebody goes to the ED.
Sure. So yep, we do the assessments at Carl Broman and then at OSF. At Carl Broman, they do have another crisis counselor that sometimes will meet with somebody, but if he is busy or different things, I think in Anthony's back, so I'll let him answer too in a second. So he'll sometimes see some people, but yeah, when he's busy, then we'll come out. The main thing that I like to be upfront, with people is that you will have to wait sometimes a little bit to see us because of the fact that we have that medical clearance piece. So there is some different steps that you would have to take in order to be cleared to be able to see us. And that's mostly because we are not medical doctors, we're counselors. And so we wouldn't be able to tell if maybe you're experiencing some of your mental health symptoms because, like, let's say your blood sugar might be too high, too low, your blood pressure is too high, too low. Sometimes things like that can be in place. And so we wouldn't necessarily be able to do that because we aren't those doctors. So I will throw it to Anthony for more specifics, but the question is basically, what's it like when somebody comes into the emergency room? What would that be like?
So very much so the process for the ED, when people are coming in with, an acute crisis event, as I had said earlier, one of the most important things for us is to keep people safe. But what we also are doing is we're going to be ruling out any possible medical abnormalities that may be occurring. Megan spoke to like the idea of blood glucose, which is one thing that you look at in some certain situations. We may be evaluating cognitive function, which is like your thinking. Are you alert, oriented? Is it a possible medication reaction? Things along those lines. So that process when you come in is, yes, it's kind of a two-pronged approach. Is one side we're going to be making the room safe, making sure that you're safe, providing a sitter to sit with you during your time period in which you're here with us. But the other side of things, we're going to be collecting blood. We are going to be making sure that we'll take essentially a picture of your heart. Have a provider come in and evaluate you, ask you questions, do a review of systems is what we call it. So kind of a quick head to toe assessment of, possibly what else could be going on in this situation. So we rule out the medical so that then we can get the psychiatric side of things taken care of. And then once we're good on that medical front, then we can rule out all those acute things and your lab values are good and you don't have anything that requires admission to the hospital. That's when we really transition to that crisis team, being able to come in, do their assessments, and then be working towards placement in that time period. So that's really the role that we play for those in the ED process. It can be kind of long at times, yes, but many times, like I tell patients just in general, is that the testing that we do in the time period that you're there, if you were doing it outpatient, it would take it'd take weeks to do, and we get results quickly in a relatively quick turnaround because there are a lot of things that come through. In the end, placement takes a little bit longer at times. We have to set up transport and things along those lines, but during that process, we really do really embrace that idea of providing that safe place for you in your time of need.
Thank you to each of you. I wonder, so each one of you have talked about either sort of problem solving for resources or referring to ongoing supports. And I wonder if Kevin, if you would be willing to start to talk a little bit about what some of the resources are and how people access them. And if you would maybe lead into that sort of second part of our presentation so that people know what and how to access.
Yeah, so let me transition that. So at the beginning, like I had said, and I'm going to share a PowerPoint here as well to kind of guide this along. I'm not going to go over it into a ton of detail, but at the beginning, I talked about how we provide services through 211. That's where primarily our calls are coming from. We're handling 60,000 calls a year through all of our different phone lines combined. I think we were just under 60,000 in 2020. But I do want to, so I clicked something that said I'm sharing my screen. Am I actually sharing my screen right now? Okay, so you can see it. Okay, great. So you can see this PowerPoint right here, right now. Okay, perfect, because I can't see you guys anymore. So in case someone wants to say something, just feel free, interrupt me, because I don't want to take up all of the time. I think crisis team specifically, you do a good job too of I know you have that binder of different resources and whatnot that you would provide people. So I don't want to steal this show, but 211 is something that was established in the nation in the 90s, I believe. The original 211 center was in Atlanta, Georgia, and that kind of quickly expanded. And now Illinois is actually one of just a couple states that isn't entirely covered by 211 services. We're the largest provider of 211 in Illinois, and the goal is, the way I like to think of it is, if you're in a physical crisis, it is drilled into our heads. Call 911. Call 911 if you're in an emergency. Do this sort of thing, and someone will be there to help you. With 211, it's information and referral primarily for health and human services. And so, when we're talking about crisis, that goes hands in hand with crisis, because usually there is something causing that crisis. And when we're looking at the nation right now, a lot of times that's going to be unemployment. That's going to be loss of job, inability to pay rent, inability to pay your utilities, inability to put food on the table. Maybe you lost your health insurance from your provider and you still need medical care. Where are you going to go for these sorts of things? And so 211, we are there primarily to offer connections to those resources. And because we're sort of what we call a blended agency, we're talking with those individuals, not just assessing and just passing them along. It's we want to make sure and check in that you're actually doing okay. And we come up with this plan and we offer follow-up as well. And there's different ways to get connected with 211. And so, tell all your friends, 211 is there 24/7. We don't, like I said, service the entire state. We do service all of McLean County. And there's different ways to get connected. The best experience you're going to have is by picking up the phone and dialing 211. That's how this service started. That's how it's built around. That being said, we're adjusting to the times, and So through PATH, as you can see in the PowerPoint here, there are additional ways to reach that. We've recently updated our database and our category search system to provide a more user-friendly experience online. The issue sometimes is that you go through a 48-hour training to navigate these resources. I'll just show you a quick example real quick. Would someone be able to tell me, can you see my screen right now with the website that I just opened up?
Yes. No.
Okay, great.
I can't.
No.
Sorry.
Okay.
I said yes, but no, I can't see the website. Now I can.
Okay. You can. Okay, so I've got two screens, so I just got to put it on the right screen. So I clicked the link findhelp211.org, and this goes. It's based in our website, and we're actually updating our website to a new platform pretty soon here. But this is still going to be available, and so we have got these, pretty icons. COVID-19, that's a big thing, but behavioral health crisis services, food, health, medical, housing, homeless. We've got all these different categories that makes it relatively easy to navigate, but you would do something as simple as entering in your zip code and whatnot, and then clicking these resources. And in category search, it's organized in certain ways, and so you're going to find different things. And sometimes it's not super intuitive, is what I'm getting at. And so that's why you're going to get the best experience by calling 211. Because our volunteers are trained to navigate these resources. We have to use a taxonomy system that's through one of our accrediting agencies, AIRS. That's a nationally used sort of taxonomy system. So, when someone's looking for potentially a motel stay because they're homeless, you're going to need that specific term, homeless motel vouchers. I think I clicked on COVID resources specifically, so that's what all these are attached to. But the logic still sort of stands there. So there is this 100% accessibility online through findhelp211.org. And if you know how to navigate that, that's going to be extremely useful. If you don't know how to navigate that, you might get a little frustrated trying to find something. We try to make it as simple as possible. And like I said, we updated our categories to make that even simpler just within the last few months here. But you're still probably going to get that best experience through calling 211. For resources. We also recently added texting services, and we're going to be doing some more marketing on this over the course of this year. But this is something that's provided, it's based on provider. Some people don't provide this. We only recently started this, and so this might be the first time you're hearing about this, but you can text your zip code. If I pull this off here, so what you'll see here is you can text your zip code to 898-211, and during business hours, right now we're operating at a limited capacity with texting. You'll get connected to a staff member who can then do exactly what we do over the phones. A lot of times people over texting, they are just looking for that quick resource of sorts. But we're going to, figure out what is the need, gather some basic demographic information so we can locate the correct resource for you and your need. And a lot of times that's going to be nowadays financial assistance, food, sometimes longer term counseling and whatnot, but that's all based on your specific situation. And so whether you call 211 or text your zip code to 898-211, we're going to be available. We're available 24/7 over the phone, limited hours, Monday through Friday, 8:30 to 4:30 right now through texting. We're trying to expand that, but that's taking a little time with planning and training and whatnot. So without, like I said, stealing the show, I've got this 34 slide PowerPoint, and I'm not going to go over it in detail. I just want to give you an idea of, if you do call 211, there's all of these different resources that are going to be available. And you might be surprised by the amount of detail that there is, and why I want to continue to sell. If you're unsure or if you are in need, call 211, because it's not as simple as just Googling resources and finding what's going to work for you. There's lots of eligibility requirements. There's lots of different things that factor in. And so I just wanted to take the example of if someone's in need of financial assistance, what you might do. And this might mean emergency rent, emergency utility, general income support programs, so things like unemployment, SSI, disability, and then other forms of financial assistance. And if we can, I'd like to send out this PowerPoint. This is actually something that we're working on as an agency. Our database department is doing a wonderful job transitioning since COVID started. We did provide in-person resource seminars. COVID hit, we can't do that in the small room that we have here at PATH now. So we're transitioning to online resource seminars. And so I took a lot of this stuff from the database department and just plopped it in here, because it's all of the resources that are available in McLean County. And so there's going to be lots of different connections and references here. And this isn't all of it either. There's a lot more than what I'm about to show you. But like I said, primarily, we're going to look at what is the need, what exactly is the situation, if it's emergency, what are we going to do, longer term solutions, and then there's other specific solutions. And that's kind of the mindset when we're trying to assess what might someone need as far as resources are concerned. What can we do? And so a lot of times people need rent assistance right now. They just got their eviction notice. Right now there's moratoriums on evictions, and we're probably looking at a different kind of crisis in a couple of months when people have to start paying for back pay on rent and whatnot. I know the county is working on different ways to handle that currently. But a lot of times people are in need of that emergency rent, emergency utility assistance. They're going to get shut off if they don't get this help within the next 5 days or so. And so there's going to be different resources available. Now, this is the quick and easy breakdown of all of that. I'm going to go into a little detail on some of these. But like I said, I think this PowerPoint might be most helpful in just reminding people, if you need something, call 211. If we can share this PowerPoint as well with the attendees, I don't know if that's possible, like you download it. You'll have access to these slides where here's the quick and easy numbers for yourselves. But we only refer to these places based on the criteria. And so it doesn't mean that all of those places will help everyone, right? So through Mid-Central Community Action, for example, they have both rent and utility assistance. Through one, their income support coaching program, and these are some of their missions and what they do. But also through their practical money skills orientation program, that's a case where there isn't an emergency needed. And so when we talk about eligibility, it's usually something out of your control, set you behind. You lost your job due to COVID. You lost your health insurance, whatever it might be. Something has to set you behind that was out of your control. It isn't that you quit your job. That was your decision. It's that you got let go, sort of thing. And they also provide locally the LIHEAP program as well. And so, like I said, I'm not going to go into all of these details, but you'll see as I'm kind of cruising through this, they're going to provide different things. Sometimes furnace repair, sometimes weatherization to make sure that your utility bill isn't going to be extremely high. It looks like in the handouts portion, if you are looking at your little sidebar here, the PowerPoint was shared, so you should be able to download that yourself, and I think that'll be really handy for different resources. But you only qualify for LIHEAP if you're at or above 200% of the federal poverty level. And so you have to know what that means too. And so there's lots of these different stipulations. The federal government, they're going to put out yearly, I think it bleeds into 2021 a little, so I believe these numbers are still accurate, but federal poverty guidelines. And so based on a 30-day period, how much money are you making? And if your family size is, let's look at 3, for example. So you have 3 people, it's you, your spouse, and your child. And you are making $1,700 a month. That means you fall below 100% of that federal poverty level. You're considered in poverty by the federal government. Well, LIHEAP, if you look at 3 and you're at 200% of the poverty level, it's going to be, if you make up to $3,620 with that family size, you would still qualify for LIHEAP. And so these different things are going to matter as you're looking for assistance. With Salvation Army, primarily they provide rent and utility assistance, but you need a referral from a caseworker. So you aren't always going to be able to get that assistance. You need to be working with someone else. Typically, you also need that eviction and shut-off notice. That's looking a little different right now with COVID. I am going to talk about COVID-specific resources because we have this big lump of money that came as part of the federal package that we are distributing in the county. But they also have different programs, like specifically if you're a NICOR customer, or specifically if you're an Ameren customer as well, the Warm Neighbors, Cool Friends program. And so like if you were to qualify for LIHEAP, you wouldn't qualify for the Warm Neighbors, Cool Friends program because they have different income requirements. If you look at this, 200% to 350% of the federal poverty level. So you can't sort of like double dip, as some people might say, into different funds. And so again, the picture I'm sort of trying to paint is this can be confusing, right? And this is why it might be more helpful to call 211 and talk to people who are trained to navigate some of this stuff. There is some other programs out there, the Society of St. Vincent de Paul, where they're providing some assistance as well. And then you look at different townships as well, and they provide assistance both in emergency capacities and in general assistance capacities. And I'll talk a little bit about that. But generally speaking, so I've got Bloomington Township, Normal Township, and then if you're in the rest of McLean County, there's a township screening for rural McLean County is what it's called. And so same sort of deal. There's going to be specific eligibility requirements, 75% of the federal poverty level, these sorts of things. And so there's numbers based on your township here. For rural McLean County, a lot of that is the same point of contact. So again, and actually, as I'm looking at this, I don't see the time. I want to quick minimize that. Okay, I still have plenty of time. I'm zooming through this, so I just wanted to make sure I'm not taking up a ridiculous amount of time here. Can you all still see the PowerPoint? It moved to a different screen on my computer here.
Yes, we can still see it.
Okay, perfect. So there's also going to be different monthly income support programs. So whether that's going to be unemployment, whether that's going to be specific to people who have some sort of disability, whether you're a family or an individual, like TANF versus general assistance programs. There's all of these different things out here, Social Security disability, and whatnot. And so these slides are just going to go over that specifically. But again, I'm not going to go heavy into the detail here. There are just different acronyms and what those might stand for. And again, they're going to have their specific requirements as well. You can't receive Social Security disability if you don't have a disability. That's usually a medical condition, a mental health condition, whatever that might be. And so there's different qualifications, again, to receive this sort of assistance. So one thing that we might do on the phone lines is we'll try to assess some of this stuff. So, you know, you're in need of utility assistance right now. One, have you reached out to anyone else for help? But two, you know, what is the situation? A lot of times callers will just come right out and tell us, you know, I'm disabled, but I haven't been able to receive disability, or I don't know how to apply for disability, and we can provide you with that information. And again, there's going to be specific programs. This program is called Aid to the Aged, Blind, and Disabled, AABD. So that's going to be based on those specific eligibility requirements. You need to be 65 years or older. You need to be potentially blind or have some sort of disability, visual impairment, whatever it might be. A lot of times people haven't yet applied for SNAP, the Supplemental Nutrition Assistance Program. If they just started experiencing this crisis. What we're seeing right now, not so much right now, but I'd say a couple months into the pandemic, so many people who hadn't typically been in need of help, because we primarily are here for people who had low income. People who have low incomes, they tend to be more aware of 211 than the general public is. And so now we've got a lot of people who this is their first time experiencing financial crisis. They know nothing about how to apply for unemployment. They know nothing about applying for SNAP benefits. They've never experienced this before. And so we can walk you through that process over the phone, or at least provide you, with the Department of Human Services number, and that number changed since COVID started, to get you enrolled. So you might not need actually a food pantry, but you could get enrolled in SNAP and receive some of those benefits, and based on your income, and a lot of people are gonna qualify if they don't have a job currently. So yeah, and then temporary assistance for needy families. This is a specific program that's particularly for families, but it's also going to help pay for food, shelter, those basic needs sort of thing. And this is talking about the eligibility as well. State unemployment, there's going to be a specific number that you call. That's going to be through the Department of Employment Security. You need to have lost your job. You do need proof that you lost your job, that you had a recent income, that you're looking for work, which is very tough right now as we're seeing record unemployment numbers still. And then these general assistance programs, which are usually offered through the township. You can see again their numbers there. But one second, I want to make sure that you all can see my PowerPoint here. So it moved the full screen over to here. I apologize. Okay. So I think now you can probably see. Is that right?
Yes.
Okay, great. Thank you. Thank you for letting me know. I was skipping through some slides here, and now I'm on to general assistance. But again, the message is going to be the same. I think this is more just a reminder. This is a little complicated sometimes, and to call 211, we're happy to guide you through that resource. But townships are going to provide general assistance program. It's like the TANF, but for individuals. So temporary assistance for needy families, but for just like individuals. Not families, so no minor children in the home. And it's sort of always going to be a last resort. If you're receiving some sort of other financial assistance, that's going to take precedent. You aren't going to qualify for general assistance programs. And then my next few slides, because I only have 8 more slides here, and they're going to go much quicker than my last 20, and hopefully that went quick enough. But there are other financial assistance programs out there. This slide, for example, is showing that there are, it's not just rent and utilities, right? There's assistance if you need automotive repair, help with burial services, child care expense assistance, disaster relief. So if you had a fire in your home, actually, usually Red Cross is going to be the first place to go. Veterans benefits, medical care expense assistance. I'm going to talk a little more about some of this stuff. And then this is a handy slide that just kind of has all of that financial assistance stuff for McLean County, just all right there. But again, sometimes navigating that is going to be a little more difficult. Food pantries, there's a lot of food pantries. There shouldn't be anyone who's going hungry in McLean County, frankly. There's like 16, 17 food pantries. Last time I counted it, I didn't actually count this list, but that looks like 16 or 17 food pantries. All of them have their, specific hours, their specific, eligibility requirements. Usually you're going to need proof of address and some form of ID to qualify for help from a food pantry, but it varies from place to place. And so here's a handy list for some of that. This list gets updated every now and then. This is the most up-to-date one that we had as of just earlier this week or late last week. Transportation services. So I think sometimes this is a bigger issue for people who are living in rural areas of the county. Right now, this is a fun tip for everyone if you aren't aware. Connect Transit, the bus system that operates in Bloomington Normal, they're operating for free until March 8th because of COVID. So you can get free bus rides on I believe the bus route has been adjusted a little bit as of late, but their normal bus route, they have disability related transportation as well through Connect Mobility, that's through Connect Transit, different contact information, but same sort of service is being provided. But again, that's free until March 8th, at least March 8th. We'll see what happens with COVID, and like I said, we keep seeing the eviction moratorium pushed. Maybe we'll see other things pushed as well, student loans, all of that stuff. There is also non-emergency medical transportation. There's senior ride programs through Faith in Action. The show bus is going to be, that's rural public transportation. And so Monday through Friday, you can call this phone number to hopefully, if you're in the town of McLean and you need to get to Towanda for a doctor's appointment, or whatever it might be, there are options out there even for folks who are living in the rural areas, and I think that's important. Transportation, when you look at rural areas, generally speaking, that's one of the highest unmet needs. We'll see, and we have that need, or that that availability here in McLean County. Homelessness and housing, we are seeing a ton of this at PATH. I haven't talked about our homeless services program a whole lot because I'm with our call center, but even through 211, we have our entire homeless services program where we have outreach workers at PATH, and kind of keeping tabs on different needs within that population and going out to the shelters and doing everything that we can to provide people with identifications and whatnot so they can get a job, and sometimes proof of address, and lots of different things that we do at PATH. But here are going to be some of your other resources. So there's the housing authority, but there's all the shelters too. So like the crisis nursery, they're not necessarily a homeless shelter. They're there to provide aid to parents who are maybe unable to provide some care temporarily for their children, age 0 to 6. And so sometimes that can serve as almost like a shelter of sorts. If someone has a child that they can't take care of because they don't have a home right now, and maybe that child can stay at the crisis nursery. Home Sweet Home Ministries, that's going to be our family shelter. So adults and kids up to a certain age. Neville House, that's our local domestic violence shelter. We've seen domestic violence rates go up during the pandemic because a lot of times people are at home with their abuser. And so it's like, what do you do in that situation? In McLean County, we've got the Neville House, and that's available 24/7. We have our entire homeless outreach program. We have been providing housing to people who, while there's been outbreaks at different shelters and whatnot, and so they're operating at lower capacity. So we're providing sometimes hotel stays to people who are homeless and don't have anywhere else to stay, obviously. And so, we've had a pool of money come in from all these COVID funds that are helping with that specifically. Project Oz, that's going to be our runaway and youth shelter, and then Salvation Army, that's our adults only shelter, Safe Harbor. And then just a couple more slides. Medical dental care. These are some of these things. So Chestnut, which also operates the rehabilitation unit, the crisis rehabilitation unit. We talked a little bit about that earlier in the presentation. They, accept general medical care as well for people on Medicaid or Medicare. And then there's the community health care clinic. If you don't have health insurance, a lot of people have lost their health insurance recently and haven't gotten enrolled in Obamacare yet. The community health care clinic can operate and offer you that primary health care. And there's also going to be dental care as well, Lakewood Family Dental. They accept Medicaid and other forms of insurance, Optum Dental. I included the health department here as well. I actually don't know off the top of my head if they're operating with that dental clinic during COVID right now. But generally speaking, they had a dental clinic, I think, every other Friday. So, you could come in and get some basic dental work done. And then there's options for people without insurance, lower income insurance like Medicaid. older adults, Medicare, and whatnot. And then there's a lot of COVID-specific resources. So this is my last slide with resources on it, so we can wrap up and hopefully answer any questions. And I want to give time to the other panelists. I didn't want to, like I said, steal the show here. But testing sites. So we have a drive-through testing center at the Interstate Center here in McLean County. So that's open daily from 9 to 5. There's also just the general statewide hotline. I apologize if these links are a little hard to read, but these are actually clickable if you do end up downloading this. Where there's going to list, there's more testing sites than just that Interstate Center. And so if you click this link by the Illinois Department of Public Health hotline and website, that's going to bring you to a map that will pull up testing sites in your area, not just limited to McLean County. Vaccine information, we're doing that. I actually just got my vaccine yesterday. My shoulder is killing me. But it was a really simple process to sign up online. For right now, we're in phase 1A and just introduced phase 1B as well. So frontline workers and then all other essential workers and people over age 65. They're doing online sign up. So there's the link to do that through the health department. Financial assistance. We have not a bunch of funds. Different funds have come in through the federal stimulus package and state packages as well. And those are being administered through different agencies. So actually the ones that I talked a lot about, Salvation Army, townships, community action, they're the ones administering these funds. But you qualify based on your income and your family size again. And frankly, the easiest way to figure out your eligibility and which agency you should call for this help is by just dialing 211, because we have that information specifically here. And sometimes I think that can be confusing as opposed to just the general assistance programs. There's COVID specific programs. And so again, we're going to assess those situations should you call in and figure that out. And then some other food resources that are COVID specific. There's the McLean County Mutual Aid Team that is operating, and then the Robert Barcia team. They have different contacts. You can check out their websites and their email as well to reach out for help. But these are going to be available to people who are maybe self-quarantining, they're exposed to COVID, they have COVID, whatever that might be, and you can't go to a food pantry, you can't go to the grocery store with your SNAP benefits, whatever it might be. There are a couple more resources out there, and it's important that people know about that. Now, again, I ran through a lot of stuff. I ran through it really quickly. I just want to emphasize the importance and the ease of just call 211 or text your zip code to 898-211. It's difficult. We go through a 48-hour training to help navigate some of these resources. And then we provide continued training to our volunteers who are answering the phones. And so it's not as simple as just Googling stuff as much as we wish it could be that simple. There's going to be different things. Like if you Google the list of food pantries for McLean County, you're probably not going to pull them all up. If you Google the number for medical assistance, but you don't have insurance, you're probably not going to pull up the community health care clinic right away, even though that's what we would pull up if you talk to us on the phone. So again, I just want to emphasize the importance and the ease of calling 211. And I'm going to stop talking. That is a lot of words that I just said. So again, call 211 if you need help with those resources. McLean County, I'm sorry, I lied. I'm not going to stop talking. McLean County, we do an excellent job of providing not only mental health resources to the community, but like I said, like no one should be going hungry in McLean County. We've got so many food pantries, all of the counseling options, all of the, potentially rent assistance programs, whatever it might be. Like I said, I have that unique perspective of we serve 47 counties across the state. I'm not lying. I'm not just exaggerating when I say McLean County is doing a lot of this very well and much better than some of your more either right next to Chicago counties or rural counties in like Southern Illinois where there's just less resources and whatnot. The county does a lot of good work making sure different things are funded. So there's a lot to be said about the resources that are available in McLean County. and we're here to help you connect you to those resources. Now I'm done talking.
Okay. Thank you, Kevin. We'll give all of you as attendees a chance to submit questions if you have them. They can either come into individual panelists or to the group as a whole, but feel free to submit those in the questions box. I will add, not only is 211 and PATH a resource for a community member when they're not sure what resource or where to connect to, but I think it's important to recognize that PATH and 211 is also actually a resource for all of us providers. And so when we're not sure about what eligibility may be for a particular service or which resource may be the best option given a certain situation, we also reach out to PATH and to 211. And the resource binders that either Triage or Mobile Crisis or other providers keep have also largely come from a lot of the information that PATH puts together. I know most places or social services in town at least purchase at least one of the printed PATH book of all the resources. But that also doesn't stay as up to date as the online database. But as Kevin also identified, the folks who pick up the phone when you call 211 have even more knowledge than a database and have access to that really live in the moment information. And if we think about how often services have had to change in the past year with regard to COVID, you know, sometimes it's operating hours, sometimes it's that they're no longer in person, but it's virtual, or that you need a different number. So thinking through how many times things have had to change and thinking through logistically, a printed book or a website can't necessarily change as fast as what some of our services have changed. So calling 211 will almost always get you an answer. While we wait for any potential questions, do any of our panelists have anything else that they want to add that either you forgot to mention or that came to mind as our time went on, or just other fun facts that you want to share before we conclude today?
I do want to give everyone else the opportunity. I just want to say I want to say I hear a lot, whether it's directly, you know, just from someone who just learned about PATH or 211, or you know, I attend different committees and whatnot throughout the county, and a lot of times people will say, like, we should put something together that has all of the resources, you know, for the county, and wouldn't that just be so nice? And that, like, people will start doing that and they don't realize it already exists. It exists for decades, literally through PATH, and we're doing it, dare I say, the right way, where we're accredited through AIRS, the Alliance for Information Referral Systems. They're one of the primary accreditors for 211 centers. And so we have to meet certain standards on different things that we're providing. And so it's not just that we threw this together and we're like, oh, this is probably most helpful. Like, we're required to reach out to places annually for updates. People have the opportunity to reach out to us for updates. So again, I guess it's a very good resource that we keep as up to date as we can. With COVID going on, I can't tell you how busy our database staff were with everything literally changing from day to day. You know, right now we're providing resources in person. Now we're providing them just over the phone. Now we're providing them virtually. A lot of things change, and we don't even get those updates as often as probably we should. But you know, we're always doing our best, and we have staff members who are dedicated specifically to our database to continuously update this stuff. And as Tricia said, you're going to get the most up to date if you call 211. But that online database, that's updated real time as well. So, you know, right now our staff members are going through and updating resources, and, you know, that's going to look different one minute than it did the next. So just keep that in mind, that this resource does exist. Tell your friends.
I love the new look of the website. Like, I like the little icons. So it's been a while since I looked at the website, but I love the icons, and it at least looks easy. So
Thank you. Yeah. I think it is easier than it used to be.
Yeah. In the chat box, as a quick reminder to everyone, there is a link to connect you with upcoming forum sessions. It's on the county website, found through the Behavioral Health Department on the events page, in case you sort of want a verbal reminder or can't see the chat box. We do have a session tomorrow afternoon that Megan is presenting on moving from anxiety to well-being, as well as several more sessions coming up still within the month of January and all the way through the end of April. And we hope you'll continue to join us. If you missed a session or want to watch this one again, because it has so much information in it, BHCC does have a YouTube channel, so we're making sure that all of our sessions get uploaded there, and it will be available usually in about a 48-hour time period, although I also say give us a week just in case, but for the most part, they've been going up within about 24 to 48 hours. I want to thank all of you for attending today, but I also really want to thank our panelists who gave their morning, but also commit their time every day to helping folks within our community in some capacity. So thank you to all of you, and we look forward to seeing all of you soon. Have a good day.
I have one more comment.
Thanks for having me.
Sorry.
Take care. Bye-bye.
A quick comment that there's no wrong way to access any of our services. I want, if you take away anything, like, we're going to help get the person connected to the right resource, whether you go through PATH, crisis team, or triage, or the police, or the hospital. We're all working together to get the person the best help they can. Sorry, I just wanted to throw that out there.
It's a great reminder, and I think I can probably safely speak on behalf of everyone that we all have the goal of helping people get connected to the ongoing help that they need, and with as few movements and disruptions through the system as possible. So I think we all have the goal of not having to send people to this place to then go to that place onto another. And so we want to get you connected in the moment to the right place, whatever that level of care may be. But I'll open it. Does anyone have anything else they want to add before we end? Okay.
I'd just like to echo that as well, and echo what I had said earlier. I think I'm blessed to be working in McLean County. When I look at some other counties and how some of them are operating and the different resources that are available, we've got our county teams and our committees and whatnot, and we're actively trying to work with each other and make everything as accessible as possible to the people who are actually in need. So I just want to emphasize how important that is, and don't take for granted all of the resources that are available in McLean County, because it's certainly a lot more than some other areas. And so, we're happy to provide help and work with everyone that we can.
I would agree. I think sometimes we're so used to what we do have that we don't recognize that it's a lot more than other areas. And that we have other counties and jurisdictions who reach out to us to know how we started something or how we all work together, or just better understand and learn from us because we are doing more. And I agree with Kevin. I think it's good that we recognize what we have and how we all work together, which is a great thing. So, all right. Thank you all. Have a wonderful Wednesday, and some of us will see you again tomorrow.